Good morning. I'm Janie Parrish with the Wadsworth Area Chamber of Commerce, and you are zooming into business, and we're zooming right to the east side of Wadsworth to Community Health Center. And in Community Health Center is one of our favorite doctors, Dr. Rachel Patel. So good morning, Dr. Patel.
Good morning.
Oh, guys, we're glad to see you. You just came back from maternity leave.
Yeah.
You know, we're get back and then we're saying, hey, we need to do an interview. So here we are. Yeah. So before we talk about Community Health Center, because you're the main physician there, and so give us just a little background on you, your education, where you went to school and things.
Sure. Yeah, I'm originally from West Ohio, Fremont, Ohio, but my mom has a lot of family that lives in Medina. So we grew up kind of coming out to the Medina and Wadsworth area to visit family. So I went to high school and elementary there. Then I did my undergraduate training at Youngstown State University for a couple years, just 2 years. And then I went to Northeast Ohio Medical University, formerly known as NEO-UCOM, out in Rootstown, and did my 4 years of medical education there. I ended up choosing family medicine, after going through rotations. I really loved just like the long-term relationships with patients. I loved like caring for different, multiple different generations and just kind of getting to know families and, growing up in a town that's very similar to Wadsworth, very rural, and, kind of that close-knit family, close-knit community. Family medicine really fit well with that kind of an environment that I grew up in. So I chose family medicine and had rotated in multiple, different hospitals in the area. I ended up choosing Summa Barberton for my residency. So I spent 3 years over there, so not too far from here. And after graduating, I really just fell in love with, the community here in Wadsworth. We lived near Wadsworth when I was in training, and just really, thought it fit well, with that small town feel that I grew up with in West Ohio. So we ended up just, settling in Wadsworth, and I was lucky enough to find a practice here in Wadsworth. Dr. Distel used to be here. So I joined with her about 3 years ago, and I was here with her for about, a little less than a year. And then when she had left, I took the practice over. So that's
I'm sorry. Go ahead.
Go ahead.
I interrupt everybody. Yeah.
That's all right.
It's I do that anyways, but it's even more difficult on Zoom. Yeah. So tell us about the Community Health Center, because I just want to make sure that people realize what goes on in the health center, that it's not an emergency room, that it's a practice.
Yeah, so community healthcare is a family practice office. Currently, we have myself and then Nancy Scaglione, one of the family nurse practitioners, with us. We're hoping to bring in more providers to the office eventually. We offer, care from pediatrics until, and then young adults and, middle-aged adults and geriatrics. We do, outpatient care in the office. A lot of times, we will do chronic care management. So like, blood pressure, sugar problems, physicals. But then we also do, same day appointments. So, you cut your finger, you need, it looked at, you need it stitched up, we'll call you, we'll get you in same day. Same thing for, cough and colds, which mostly we're doing virtual visits for at this point in light of everything going on. But urinary tract infections, abdominal pain, anything that comes up. Our goal as a practice really is to keep you in our office for the majority of your care. So, if something comes up and you feel that it's urgent, we really try to get you in the same day, if not the next day, and, keeping you with a physician that knows you and, knows your history and can work, problems up appropriately and efficiently. And especially with everything going on right now, in our community, really trying to keep, patients out of the hospital and with their primary care doctor for acute complaints in order to free up the ERs for, patients who need more urgent care.
That is amazing. And I love that, because that continuum of care is so important, to feel comfortable about your physician, and I really like that. So tell me, what is so unique about community health care?
So I think one of the unique things about our practice, compared to other primary care practices, is the way that the office is structured. The people who answer the phones when you call are also the same people who work and room you in the office. So, and a lot of the girls who are in my office have actually been here longer than I have. So they know the patients, very well. They know the community well. Which really, I think, facilitates, great care for patients, because if someone calls in and has a problem that's going on that's urgent, and, they don't see like an opening on my schedule, a lot of times they'll pull me aside and say, hey, Dr. Patel, this person's really, worried about this. I really feel like they need to be seen earlier, but there's nothing open, and we'll figure out a way to kind of finagle things to get people in. And really create access where maybe on first glance it wouldn't be. Some other practices are kind of shifting their phone triage to people who are more in like an not like in the office with the physician. So I think we have like better office communication and better able to like care for patients and create access where there needs to be because of that structure of our office.
Very cool.
And the nice thing too is, even though we're community healthcare in Wadsworth, there are community healthcare offices like in other, surrounding towns. So like Norton, Barberton, Doylestown. So if for some reason, our office is completely booked, or, I'm out of town and there's only one provider here, we can always find a spot for a patient to be seen. They may have to drive a little bit further, but there are other offices, that can accommodate that if we need. And, it does, help that we have other offices, because some of the other offices offer other services. So like our Norton office does have a behavioral health counselor. So if we have someone, who is really struggling with their mental health and needs to see a counselor urgently, a lot of times we can get patients in with that counselor in Norton, which isn't too far, in a short time, while finding them a counselor in the community. For them to have a more long-term relationship with. So that's really nice. The other great thing about our office is we have a care manager who's employed by our office. And so for no cost to patient, if I have a patient who for some reason, is uncontrolled, say they come in for a regular blood pressure check and their blood pressure's, uncontrolled, and we're doing a little bit of medication adjustments, I can have that care manager, follow up with that patient in a week. And, if the patient has a home blood pressure cuff, she'll say, what are your readings like? How are you feeling on the new medicine? Are you having any side effects? And then she'll, send me a message and let me know how the patient's doing. And likewise for other medical problems that people are, struggling with, she'll, kind of coordinate the care and do some follow-up with the patients to make sure things are moving in the right direction. And that really, I think, has been very helpful, for me as a provider. And I think patients really, enjoy that close contact that the office has in between those visits to make sure that, when changes are made, things are moving in the right direction.
Very nice. And that very, very nice. Why do you love what you do, Dr. Patel?
I really, from the medical science perspective, I love the challenge of figuring out a problem. I really like that aspect of, someone coming in with something and, really, not knowing, what's causing this, and, them being, struggling, and then being able to find a solution, and then ultimately seeing them improve. I love helping people. That's always been something that I've enjoyed. And, my mom really modeled that very well for me, community service and volunteering, like as I was growing up. So I think, having that background, I always saw myself in more of a service field. And then just kind of my love for science and, problem solving kind of led me to this path. In terms of, choosing family medicine and community-based medicine, I really like, the small town feel. I like having patients who know each other and are friends and family, and who kind of give me a heads up on what's going on, from a social level, because, caring for a patient, can be about, controlling their high blood pressure, but it's also kind of being aware of the social situations that are impacting the overall health of the patient, So as stressors come up in our life, it can definitely impact chronic disease management. And then also stressors that impact, financial situations, access to healthy foods, access to, means to stay active, and things like that. So I really felt like, this was a great fit for me. And, family medicine, I think is one of those fields that really has evolved over time. If you talk to family docs who are doing this, I don't know, even 20, 30 years ago, they were doing a lot more OB and maternity and delivering babies. And now we've kind of shifted to more of an outpatient role. But I think still, we can provide great care and keep people healthy and, out of the hospital. And by creating a lot access within the office, I think that's a great approach.
Great. Now, how can people find you in community healthcare?
Yeah, we're located, if you know where the high school is, there's that Circle K and Dollar General over there. We're right next to the Dollar General. Our phone number, is available. I don't know, are you sending that with the interview in the information? Yeah. Okay. Yeah. So our number is 330-331-7106. We're accepting, patients, new patients, just contingent on if we're contracted with the insurance plan. So you can call that number. We can get you in. There is a little bit of a wait, but not too bad.
Okay.
And we're located at 860 Broad Street.
Oh, well, thank you so very much. Boy, we learned a lot today about community healthcare. We really appreciate you and your staff and all that's going on, and welcome to that new baby.
Oh, thank you. And thank you, Jeannie, for, hosting this. It's always nice talking with you.
Absolutely. Okay. Enjoy the rest of your day.
All right. You too. Bye.